Hi everyone, my name is Dr. Gideon Kwok, lifestyle architect with AI Wellness TV, and we are bringing you some amazing products developed by Dr. Hootan, and we're gonna deep dive into why you guys always need to be on this product. And so I'm gonna thank you for being
Thank you for having me.
And let's get a little background. What's your background? Where are you from?
So I've been a pharmacist 21 years.
Wow.
Graduated from Roseman University of Health Sciences in Las Vegas, right down the street.
Nice.
Yes, first graduating class. Got my PharmD degree, Doctor of Pharmacy. Started working in different retail settings, and then I was always intrigued by creating products and what goes in a product, what are the different types of products, what are the preservatives, additives.
Right.
And that's how it led me, had a bunch of compounding different pharmacies.
Okay.
And that's what led me to create NuDora.
Nice. So explain to us kind of what is NuDora? Where'd the name come from?
So anyone that has kids and they used to watch the cartoon Dora the Explorer.
Oh,
right? So
awesome.
NuDora. So NuDora is basically new gut,
okay.
new body. We wanted to help create something that's different than what's in the market.
Okay.
One of the problems I noticed when I was a pharmacist was they would come in and say, what probiotics do I take?
Right.
How do I know what's right for me?
True.
If it's supposed to be gut specific, there's 1,000 different variations.
For sure.
I'm on an antibiotic, my doctor said go get a probiotic.
Yep.
And the problem was most people had more side effects with probiotics than the benefits.
Oh.
Or I would hear things like, it didn't work.
Right.
Or why this one? Or I had more upset stomach. Oh, I was in pain. I stopped taking it. And people really take probiotics based on either word of mouth.
Right.
My mom was taking it.
Yep.
Oh, I drink my kombucha, or I have my yogurt. But they really, I don't think, know what probiotics are really meant for and why they need it.
So explain that. Let's get back to the basics of probiotics. For those that don't even know what probiotics are, I'm sure, we all hear the buzzword, but really, I don't think anybody completely understands in the general population. They're just like, I was referred to take it because I said I need something gut health. But what really is probiotics, and what is the pathophys, and why it's important to actually replace it?
The best way I could say probiotics is replace bad with good.
Okay.
Our body has millions and millions of different types of bacteria already in our gut.
Right.
And we know that our gut is where all the nutrients are absorbed, food goes, it's your colon, your intestines, your stomach, that's considered the gut.
Yeah. The gut having good flora actually is part of wellness. People don't understand that. Being in the aesthetic world, I'm a big believer that, what we put in comes out as the beauty aspect. And I really do emphasize patients to be on something that is supportive of that aspect of it. Because, from here to there is actually, you consider it the outside world.
Of course,
right?
100%.
And people don't actually think of it that way. And it's the gut and all the flora and all the bacteria that break down the foods, break down all of that allow your body to actually absorb things.
Correct.
Because if you don't have the right balance for your body,
that's where all the symptoms come from.
You end up not actually absorbing, and you end up inflaming, if anything, and then prevent yourself from getting the proper nutrition.
Correct. So the funny part is about inflaming, like we wake up, my back hurts, my knee hurts. We go to the doctor. Today's typical medicine is, here's a prescription, some pain medication, anti-inflammatories. Well, the problem with those is it leads to more side effects. So it could lead to ulcers, stomach issues, constipation, nausea. Nobody is there to fix the source of the issue.
The Band-Aid.
The Band-Aid, correct. And we know that the gut is your second brain. So whatever we do in our gut, it sends signal to the rest of your body, right?
Amazing.
So in the aesthetic world, like you said, if you want to look good on the outside, you have to feel good on the inside so that you get to recoup faster. So if you're having minor surgeries, correct. And that's what NuDora was developed and why we created NuDora.
Amazing. So tell me about the products. Let's go over the product lines that you have.
So our first product that we created was our orange. We go based on colors. It makes it easier for everyone.
Makes sense.
So NuDora orange, the aesthetic look of it, we wanted to do something. If we're going to be different, we want to look different, right? So my wife created all these all the types of packaging and the bottles and everything, and I give her all the credit.
It's beautiful.
Thank you, thank you. So it's a glass bottle.
Okay.
Right, so we put a bamboo cap. to try to give you that natural look as well. All of our products are in a vegetarian capsule.
Okay.
There's no additive, no sugar, no dairy-free, gluten-free, soy-free. So basically, there's no preservative.
Beautiful.
What's in it is all you see.
Okay.
Our first one, being our orange one, helps with weight loss, inflammation. We've seen people with endometriosis getting great results.
Wow.
We've seen people with PCOS, which is polycystic ovarian syndrome.
Huge.
And we have people swear up and down that it's cleared up their skin, gives them that glowing look.
Wow.
So we have people that had massive rosacea. They took the product and they don't need to put a lot of makeup to cover the rosacea.
What was the concept behind creating this as far as what goes in there, the bacteria, what was the concept on that aspect of it, I guess?
So the whole concept of NuDora was condition-specific probiotics. And by condition means what your needs are.
Okay.
So we all have different symptoms in our body, right?
Of course.
We know majority of the population in the world suffer either from some form of inflammation, weight gain, either they're constipated or bloated,
Huge.
or mental health challenge. And I think today the mental health challenge far exceeds anything else.
Yeah, the stress, all of that goes together.
So what I did was I read all the studies to try to understand what probiotics even were.
Right.
We had no idea. And then the concept of how I got into it was when my dad got sick, they kept putting him on different probiotics. And I'm like, this makes no sense.
Right.
So I figured out that each bacteria has a specific role and function.
Okay.
Then I figured out which bacteria are for what condition.
Okay.
And then we grouped them together.
Okay.
Then we added specific herbal and minerals for each condition.
Nice.
So in our weight loss inflammation, we have ginger and green tea.
Okay.
Okay. In our new formulation that's going to come out, we added berberine as well.
Okay.
So it helps with that weight loss.
Beautiful.
The whole point of NuDora is you don't need so many pills. You don't need to go buy 37 bottles.
Right.
You know, if we could fix the gut and that lets the brain access, you know, we have that gut-brain access that allows the gut to send signal.
Right.
And will give you the right herbal, you don't need to take that many pills, that many capsules.
Okay. Once you take it, go through with me, like, you know, some people like to understand kind of what's going on. Like you take it, the stomach breaks it down, the bacteria start to grow into the area, overtake. What's the thought behind that as far as?
So each of the products will affect the symptoms that you're experiencing, right? So it'll go in, so either it'll affect the gut or the colon or the small intestine and so forth.
Okay.
And then over time, it's going to get rid of all of those bacteria that's causing those symptoms. And then that's going to allow you to feel better.
Okay.
So I'll use myself as a guinea pig. You know, when you build a new business, you're just overeating and stressed.
Of course.
So I blew up to about 242 pounds. I wasn't sleeping, I was stress eating, and I was snoring. And the snoring was really out of control. It took me about 6 weeks of taking our own product.
Okay.
I stopped snoring. I could sleep 8 hours, 6 to 8 hours.
Wow.
I do not have that stress eating desire anymore. And I dropped to about 218 in about 7-8 weeks.
Wow.
But they all work synergistically together. So if I didn't sleep, I wouldn't have had the energy. And because it was getting rid of those bad bacteria, Uber Eats probably lost a lot of money on this because those days were gone. And I still don't have them. I mean, we're almost 2 years into it.
That's amazing. That is amazing. Okay, so we have this one to weight loss, decreasing inflammation, pain, PCOS, endometriosis. So based off of that aspect of gut, what are the other products that we have?
On the aesthetic side, if you're having surgery, it's a great product to start with because it helps you heal faster.
Okay.
Right? You guys do the arnica and so forth, so this is on the inside.
Beautiful.
This is our mental health, anxiety, mood boosting, stress relief.
Okay.
So besides our probiotic, prebiotic, we also added things like ashwagandha, L-theanine, valerian, magnesium citrate, magnesium oxide, and saffron.
Okay.
So it's 2 capsules a day.
Okay.
The good thing about it is that if you could take 2 in the morning, I could take 1 in the morning, 1 at night.
Okay.
So you have to see what works for your gut better because everyone's different.
Okay.
Right? So I personally take this and this.
Okay.
I take one of these in the morning, one of these, and then one of these at night. So you could mix and match them.
Right. Okay. As far as bacteria probiotic wise, are they the same in each one, or
No,
are they
different.
tailored to different?
They're tailored to different. So this one has 40 billion.
Okay.
Currently has 5. This has 50 billion, and this has 90 billion.
Okay.
This is our gas, constipation, bloating. We see a lot of people that have these issues, especially women.
Yes.
If it's postmenopause, premenopause, post-pregnancy, or just because they're on some form of contraceptive.
Oh,
right.
There's huge. I mean, gut like constipation is
Correct.
so huge. People
Correct.
are not having regular bowel movements. If you're not doing it at least every day, you're collecting toxins, right?
Correct.
And that's one of the big things, you know. And it starts to overload. People don't understand how the system works to get there.
Correct.
And you have to start Ola. That's great.
So we have things like aloe vera, senna, psyllium, magnesium citrate, magnesium oxide, and so forth.
Okay. Perfect.
And I believe I made a mistake. In this one, we have magnesium glycinate
Listen,
for anxiety.
a
Sorry.
lot of different magnesiums
Yeah.
that work in different things.
Yeah, different
People don't
magnesium
actually
works-
understand.
right.
Don't understand that. They just take magnesium. It's like, I need magnesium. And
Correct.
it's like, you really do need to do some research about what magnesiums affect, actually what aspects of them. Okay, so we have 3 different aspects of it. Can people take all 3, I guess? If that's what they're dealing with.
Honestly, you don't really need all 3 because one can lead the symptom of the other.
Okay.
So if I reduce your inflammation, your constipation may go away.
True.
But you can mix and match 2 of them.
I mean, to me, kind of this sounds like the most important one, the base one that you created.
This was
Because
our original formulation.
Inflammation, to me, is the key to anti-aging in general.
Correct.
And I think that's the one I would probably take every single day. And then depending on what your issues are, starting with this, with that, or this is really great. This is actually very simple, very easy to take. You definitely thought that through because nobody wants to swallow that many pills.
Yeah, and now it's gut specific. So now you know exactly what you need.
Question with me is, you know, you hear all these things with probiotics. Some people are big into like the way it's stored, what forms you're taking it. Is there anything to that? Like some are like refrigerated, liquid, and you know, people are taking these different types of probiotics, diluting out what your research has shown you. What was important for you as far as choosing probiotics themselves?
Over time, any supplement we take, including probiotics, their potency drops.
Okay.
So what we do today versus a year from now, their potency will drop. The way we created our packaging is the uniqueness about it is, obviously we put it in here so you could protect it from light.
Okay.
Light can also help diminish the potency of the probiotic, so which is why we keep it in here. You could keep it in the refrigerator. Obviously, it's not going to hurt at all.
Okay.
But the concept of refrigeration is not only help with the potency, but to protect it from light. But every time you open that refrigerator door, you're still exposed
Right.
to light, right?
True.
So this is some of the things we've done to make it really a little bit different to ensure, and it's easy to travel with.
Right.
You could just take this by yourself. You could take this with you. So those are some of the things.
Amazing. Awesome. Well, anything else with regards to maybe forward thinking what's next for you guys?
Next it's funny you say that. We always look to, if we could make a formulation better, we'll always make it better.
Okay.
So the 4 new lines we want to add is a marine concussion. I think that's
concussion. Okay.
I think you see that a lot with the elderly, with athletes who
huge.
suffer concussions and so forth.
Okay.
We also like to do something for men's health, women's health.
Definitely.
We're
need
looking into a menopause formulation.
it. Okay.
So those are some of the things that we're currently actively working on.
Beautiful. Awesome. Well, thank you so much. I mean, this has been so helpful. I'm definitely going to be on this stuff. People don't realize that the balance in your body all starts from the gut.
100%.
You know, because if you can't get rid of toxins, it's inflamed, you can't absorb nutrients, you're not going to supply the body with what it needs, and you slowly actually deteriorate. And
Correct.
people don't, unfortunately, in our world, if you don't feel it, you don't have an issue. And you know, we know in medicine that by the time you feel it and have an issue, you probably knocked out 60-70% of function.
But they may feel it, but they just don't know what to do with it. Right, they ignore it. And I think that's one of the biggest things that I faced when I was a pharmacist, and I'm sure you've seen during your medical practice. Like, they don't want to address it.
Yeah.
And I think that's one of the issues that we all notice, even ourselves in the healthcare field.
Very true. Well, thank you so much for making it simple and easy.
Thank you for having me.
But thank you so much.
Thank you. Pleasure to meet you.
All right.